Welcome to the CPHIMS Exam Preparation Podcast. In today's episode, we are going to learn to interpret clinical and operational outcomes through the use of various data analytics tools, for example, reports, tables, graphs, charts, predictive models. Interpreting clinical and operational outcomes through the use of various data analytics tools involves several key steps. These tools, including reports, tables, graphs, charts, and predictive models, can transform raw healthcare data into actionable insights. Here's how healthcare professionals, particularly those in informatics, might approach this task. Data collection and aggregation. Data cleaning and preprocessing. Analysis using tools. Interpretation of results. Decision making. Monitoring and evaluation. Communication. Ethical considerations. Let's delve into each topic. Data collection and aggregation. Data collection and aggregation in healthcare involves several crucial steps. 1. Gather data. Sources include electronic health records, EHRs. These are digital versions of patients' paper charts and contain a patient's medical history, diagnoses, medications, treatment plans, immunization dates, allergies, radiology images, and laboratory and test results. Patient surveys. These can provide insights into patient satisfaction, treatment outcomes, and quality of life. Operational systems. Data from hospital management systems, scheduling software, and other operational tools can offer insights into the efficiency and effectiveness of healthcare services. Financial systems. Information on billing, insurance claims, and other financial aspects is crucial for understanding the economic side of healthcare delivery. 2. Data aggregation. The goal here is to integrate data from these diverse sources to create a comprehensive dataset. This involves ensuring data compatibility. Data from different sources might be in different formats or structures. It needs to be standardized. Data cleaning. This step involves rectifying or removing incorrect, incomplete, corrupted, or irrelevant parts of the data. Data integration. Combining data from various sources in a way that maintains data integrity and allows for effective analysis. Data storage, storing the aggregated data in a secure, accessible, and efficient manner, often using databases or data warehouses. Conclusion. The effective use of data collection and aggregation in healthcare can lead to improved patient outcomes, enhanced operational efficiency, and better financial management. It also plays a crucial role in research, public health monitoring, and policymaking. Now, let's proceed to the next section. Data cleaning and preprocessing. Data cleaning and preprocessing are essential steps in managing and analyzing healthcare data. These steps ensure the data's reliability and usability for further analysis. Here's an overview. 1. Quality check. Accuracy. Verify the correctness of the data. In healthcare, this might involve cross-referencing patient records with other sources or checking for logical inconsistencies. For example, a patient's age and date of birth should match. Completeness. Identify an address missing or incomplete data. This could involve filling in gaps or deciding how to handle records with missing information. Consistency. Ensure that data across different sources or within different parts of the dataset are consistent. For instance, if two records refer to the same patient, they should not have conflicting information. 2. Normalization. Standardize data formats. Ensure that data across the dataset follows a uniform format. For example, dates should be in a consistent format, DDMMEIE versus MMDDEIE, and text data should have a consistent casing, for example, all lowercase. Standardize values. This involves making sure that the data values are consistent. For example, if one source records gender as MF and another as male/female, these should be standardized to a single format. Data scaling. Sometimes, it's necessary to scale the data so that variables are on a similar scale. This is particularly important in machine learning and statistical analyses. Handling outliers. Identify and manage outliers in the data. In healthcare, an outlier could be a rare medical condition or an error in data entry. The approach to handling outliers depends on their nature and the context of the analysis. Conclusion. These steps are critical in ensuring that the data is reliable and suitable for analytics, machine learning models, or any other form of data-driven decision-making in healthcare. Proper data cleaning and preprocessing can lead to more accurate and meaningful insights, which in turn can improve patient care and operational efficiency. Now, let's proceed to the next section. Analysis using tools. Analyzing healthcare data effectively can lead to insights that improve patient care, operational efficiency, and resource management. Here's how different tools and methods contribute to this process. 1. Reports. Reports are comprehensive documents that summarize findings from the data. In healthcare, reports can reveal patterns in patient outcomes, highlight areas of operational efficiency or inefficiency, and provide insights into resource utilization. Reports often include textual explanations, summaries of key findings, and recommendations based on the data analysis. 2. Tables and graphs. Tables provide a detailed, structured way to present data. They are useful for displaying raw data, statistical summaries, or specific data points. Graphs. Bar charts, ideal for comparing quantities across different categories, such as the number of patients with different conditions. Line graphs, useful for showing trends over time, like the change in admission rates over several months. Pie charts, good for illustrating proportions, such as the distribution of patients by age group. 3. Charts. Different from graphs, charts in this context refer to visual representations of processes or structures. Flowcharts, useful for mapping out healthcare processes, patient care pathways, or decision-making processes. Organizational charts display the hierarchy within a healthcare organization, showing roles, departments, and relationships between them. 4. Predictive models. These involve using statistical models and machine learning algorithms to make predictions based on historical data. In healthcare, predictive models can forecast patient outcomes, future resource needs, like bed occupancy or medication supplies, or the likelihood of disease outbreaks. Common techniques include regression analysis, classification algorithms, and time series forecasting. Conclusion. The choice of tools and methods depends on the specific objectives of the analysis, the nature of the data, and the intended audience for the findings. For instance, detailed reports and tables might be more suitable for internal operational reviews, while graphs and simpler summaries are often better for presentations to a broader audience. Predictive models are particularly valuable in strategic planning and proactive patient care management. Now, let's proceed to the next section. Interpretation of results. Interpreting results in healthcare data analysis is a critical step that transforms raw data into actionable insights. This process involves several key components. 1. Understand trends. Analyzing the data for trends involves looking at changes and patterns over time. For example, identifying an increase in certain types of illnesses during specific times of the year. Spotting anomalies is also crucial. These could be unexpected spikes in hospital admissions, unusual patterns in medication prescriptions, or sudden changes in patient satisfaction scores. Recognizing these trends and anomalies helps healthcare providers and administrators understand changes in healthcare needs, patient behaviors, and the effectiveness of treatments or interventions. 2. Outcome correlation. This involves linking data findings to specific clinical and operational outcomes. For example, correlating patient demographics or treatment protocols with recovery rates. Understanding causative factors is crucial. For instance, if a certain treatment method is correlated with higher recovery rates, it's important to understand if the treatment is the cause or if other factors, like patient age or comorbidities, are influencing the outcome. It's important to distinguish between correlation and causation. Just because two factors are correlated does not mean one causes the other. Further analysis, often involving statistical tests, is required to determine causation. Conclusion. In the context of healthcare, the interpretation of data should be done with an understanding of medical knowledge, ethical considerations, and patient privacy concerns. The insights gained from this process can guide decision-making, policy development, and strategic planning in healthcare settings. For instance, identifying trends in disease prevalence can inform public health initiatives, while understanding the factors influencing patient outcomes can lead to improvements in clinical practices. Now, let's proceed to the next section. Decision-making. The insights gained from healthcare data analysis are instrumental in guiding strategic and operational decision-making. Here's how this process typically unfolds. 1. Inform strategies. The analysis of healthcare data can significantly influence strategies and policies within a healthcare organization. For instance, if data shows a high rate of a particular health issue in a certain demographic, healthcare providers might develop targeted prevention or treatment programs. Similarly, patterns identified in patient feedback or satisfaction surveys can lead to changes in patient care practices or service delivery models. Data-driven strategies are often more effective because they are based on actual trends and evidence, rather than assumptions or general industry practices. 2. Operational improvement. Data analysis can reveal inefficiencies or bottlenecks in healthcare operations, such as prolonged patient wait times, underutilized resources, or redundant processes. Insights gained from data can lead to streamlining operational processes. For example, reallocating staff or resources based on patient flow data can improve efficiency. It can also guide decisions on resource allocation, like where to invest in new equipment or facilities, based on usage patterns and patient outcomes. Additionally, analysis of financial data can help in optimizing budgeting and financial planning, ensuring that funds are directed to areas that will have the most impact on patient care and operational efficiency. Conclusion. In both strategy formation and operational improvement, the key is to use data as a guiding tool. Decisions should be made in the context of the data, considering both the quantitative insights and qualitative factors such as patient experience, staff feedback, and broader healthcare trends. This holistic approach ensures that the decisions made are well-rounded, effective, and ultimately serve to enhance the quality of healthcare delivery. Now, let's proceed to the next section. Monitoring and evaluation. Monitoring and evaluation are crucial steps in the healthcare data analytics process, ensuring that the insights gained and actions taken are effective and adaptive to changing circumstances. Here's how these components typically work. 1. Track changes. Once changes are implemented based on data analysis, it's important to track key metrics to evaluate their impact. This involves continuous monitoring of relevant data points. For example, if a new patient care protocol is introduced, monitoring patient outcomes, readmission rates, or satisfaction scores becomes crucial to assess the effectiveness of the protocol. Tracking should be systematic and regular, with predefined metrics and intervals. This allows for timely detection of both positive outcomes and areas that need further improvement. 2. Feedback loop. A feedback loop in data analytics is a process that continuously refines and improves the analysis based on outcomes and changes in the healthcare environment. This loop involves collecting data on the results of implemented changes, analyzing this data to understand its effectiveness, and then using these insights to make further adjustments. For instance, if data shows that certain operational changes have led to improved patient flow but increased staff workload, the next step might involve adjusting staff schedules or workflows. The feedback loop ensures that data analytics is a dynamic process, adaptable to evolving healthcare scenarios, patient needs, and organizational goals. Conclusion. This ongoing process of monitoring and evaluation, coupled with a responsive feedback loop, is essential for healthcare organizations to remain agile and effective. It enables continuous improvement in healthcare delivery, operational efficiency, and patient satisfaction. Moreover, it fosters a culture of evidence-based decision-making and ensures that healthcare services evolve in alignment with the changing healthcare landscape and patient needs. Now, let's proceed to the next section. Communication. Effective communication of findings is a pivotal aspect of healthcare data analytics. It ensures that the insights gleaned from the data are understood and can be acted upon by all relevant stakeholders. Here's how this can be effectively achieved. 1. Reporting findings. The key to effective communication is presenting the data in a way that is understandable and relevant to the audience. This might vary depending on whether the audience is healthcare providers, administrators, or policymakers. For healthcare providers, findings should be presented with a focus on clinical implications and patient outcomes. This might include using clinical terminology and referencing standard healthcare practices. Administrators often benefit from a focus on operational insights, such as resource allocation, cost-benefit analyses, and efficiency improvements. Here, the language should be more aligned with management and operational effectiveness. For policymakers, the emphasis might be on population health trends, policy implications, and cost-effectiveness. The findings should be contextualized within the broader healthcare landscape and policy frameworks. 2. Formats and visualizations. Utilizing clear and concise formats is crucial. This includes structured reports, executive summaries, bullet points, and clear headings to make the information accessible. Visualizations play a crucial role in data communication. Graphs, charts, and infographics can make complex data more digestible and highlight key points effectively. Interactive dashboards can also be used, especially for administrators, allowing them to explore the data in more depth according to their specific areas of interest. Conclusion: effective communication in healthcare data analytics is not just about presenting data, it's about telling a story with the data that resonates with the audience, driving home the significance of the findings and the actions that should be considered. This requires not only a deep understanding of the data but also of the audience's needs, concerns, and decision-making processes. Now, let's proceed to the last section: ethical considerations. Ethical considerations, particularly around privacy and security, are paramount in healthcare data analytics. These considerations are not just legal requirements but are also essential for maintaining trust and safeguarding patient welfare. Here are the key aspects. 1. Privacy. Healthcare data often includes sensitive personal information. Respecting patient privacy means ensuring that this information is not disclosed or used inappropriately. Compliance with laws like the Health Insurance Portability and Accountability Act, HIPAA, in the United States, the General Data Protection Regulation, GDPR, in the European Union, and other local privacy regulations is essential. Policies should be in place for de-identifying data, removing personally identifiable information, where possible, especially in research or when sharing data. 2. Security. Healthcare data must be protected from unauthorized access, breaches, and other security threats. This involves physical, technical, and administrative safeguards. Technical safeguards include using secure servers, encryption, access controls, and regular security audits. Training staff on security protocols and having clear procedures for handling data breaches is also crucial. 3. Ethical standards. Beyond legal compliance, there are ethical standards to consider. This includes ensuring that data analytics practices do not inadvertently lead to discrimination or bias in healthcare delivery. It's important to consider the broader implications of data analytics findings and how they might affect patient care, especially in vulnerable or marginalized populations. Involving ethicists or an ethics committee in the development and review of data analytics projects can be beneficial. Conclusion: overall, maintaining privacy and security in healthcare data analytics is not just a regulatory requirement but a fundamental aspect of ethical practice. It ensures the integrity of the healthcare system and the trust of patients, which is crucial for effective healthcare delivery. As we come to the end of this episode, remember that by following this process, healthcare informatics professionals can effectively interpret clinical and operational data to enhance healthcare delivery, improve patient outcomes, and optimize operational efficiency. If you found this content valuable, please like, share, and subscribe to Professional Certifications channel.